Let's discuss differential diagnosis, Western and Chinese medicine, Menorrhagia and Metrorrhagia. Menorrhagia is a medical term that refers to excessive blood loss during a menstrual cycle that is accompanied by severe cramps, while the Metrorrhagia is a medical issue that causes irregular bleeding, mainly between two menstrual cycles. Menorrhagia indicates heavy prolonged periods, while the Metrorrhagia indicates bleeding outside the normal menstrual period. Number one organic causes, letter A, cervical cancer, postcoital, postmenopausal or intermenstrual bleeding, blood-stained vaginal discharge. Letter B, endometriosis, increasingly painful heavy periods and cramps, clotted blood, lower backache, painful sexual intercourse, painful bowel movements, premenstrual spotting, infertility. Letter C, uterine cancer, normally post-menopause with gradually increasing bleeding. In premenopausal women, irregular or intermenstrual bleeding, discharge is rare. Letter D, uterine fibroids, affects 20% of women by age 40 years. Heavy bleeding with clots, cramps, pain, intermenstrual bleeding, unusual, sensation of fullness in the lower abdomen, frequent urination, sudden severe pain if fibroid twists or degenerates, rarely malignant. Number two, functional causes, letter A, pregnancy complications, miscarriage, heavy clotted vaginal bleeding, lower backache, abdominal pain. Second, ectopic pregnancy, abnormal vaginal bleeding, lower abdominal pelvic pain, breast tenderness, nausea, low backache. If hemorrhaging occurs, there is sharp, sudden pain in the lower abdomen, dizziness, referred pain to the shoulder. Letter B, as menopause approaches, periods may be increasingly frequent, heavy, caused by hormonal imbalance. Number three, other causes include abnormal thyroid, pituitary function, changes in birth control pills, use of IUD for birth control, pelvic inflammatory disease, trauma, certain drugs, steroids, blood thinners. Chinese differentiation, Menorrhagia and Metrorrhagia, diagnostic questioning according to, first, the nature of bleeding and pain, heavy, thick, deep red, purple blood, strong odor, lower abdominal pain, irregular flow, blood heat, early red or purple blood, profuse or scanty, possible clots, starts and stops slowly, irregular flow, abdominal hypochondrial pain, stagnation of liver qi turning to heat, early moderate or profuse bleeding, phlegm heat, early following profuse vaginal discharge or dark red purplish discharge, may be foul-smelling, chronic abdominal pain, worse towards period, damp heat. Early scanty purplish blood with dark clots, pain, relief after passing clots, regular lingering flow, liver blood stasis. Early profuse lingering watery light red blood, no pain or chilly pain, better for pressure, qi, and yang deficiency. Early scanty, sticky, thick, painless lingering blood, empty heat. Excess bleeding after sex during menstruation, chong and red dysfunction. Number two, etiology, hot environment or excess hot, spicy, greasy food, full heat. Depression, that is stagnation of liver qi turning into heat. Worry, anxiety, lack of exercise, excess sweet, cold, raw food, spleen qi deficiency causing damp or phlegm heat. Overwork, kidney essence weakness, yin deficiency. Number three, Zangfu patterns. For the excess, there is blood heat, liver qi stagnation turning into heat, phlegm heat, damp heat in the lower burner, liver blood stasis. For the deficiencies, spleen Qi deficiency, kidney yang deficiency, kidney yin deficiency, Chong and Ren disharmony. Thank you for your attention.